Welcome. My name is Kelly Parsley, and I am a co-director of Montana Families for Vaccines. I have been working for Montana Families for Vaccines for the last year and a half, and I have to tell you, I'm very, very proud to be part of an organization that helps to keep our Montana families safe and healthy. We are hoping that you have already had a chance to watch a video called Hilleman, The Perilous Quest to Save the World's Children. When you registered for this panel discussion, you should have been sent a link to watch that video for free. It's a video about just an amazing man named Maurice Hilleman from Miles City, Montana. If you had problems with that or you didn't get a chance to watch the video, I'm going to ask Aaron to put our Montana Families for Vaccine link into the chat so people can reach out to us and we can fix that problem. Thank you. And thank you all for joining us. This is a very important discussion for us to be having right now. Most of you probably already know that August is Vaccine Awareness Month. Some of you probably don't know that it is also Maurice Hilleman's birthday. He was born August 30th, 1919. So he would be a nice, young, spry 105-year-old today. Um, but he was a man who touched this world in so many ways. Um, he developed 40 vaccines, many of which we still routinely use today. He helped prevent pandemic flu. He combined the measles, mumps, and rubella vaccines, the MMR. He developed the first vaccine against a type of human cancer, and so much more. It is likely that Dr. Hilleman's work has saved more lives worldwide than any other scientist in the history of humankind. And most of you also know that we have a political climate that is just making this kind of work a challenge, all the more reason for us to come together today and have this discussion. So today, I am joined by my co-directors for Montana Families for Vaccines, Ann Longji and Aaron Harris. And Ann, I would invite you to introduce yourself.
Yes, thanks for joining us, everyone. My name is Ann Longji, and I am based in Montana with my colleagues. I spent many years in West Africa, and I'm surprised that coming back to the US, I have to still work on issues related to vaccines and the policies that are being promoted or those things that are being decided that hinder access and also spread miseducation. Thrilled to be with this group of folks today. Thanks to everyone for joining, especially our panelists.
Thank
Aaron?
you.
Hi, my name is Erin Harris, and I've been a co-director here with Montana Families for Vaccines since last fall. I think the work is important for me because with 4 kids and 1 granddaughter, I always want the best for them, and this work helps make that possible. And I'm grateful to be here, and I'm grateful to the rest of you to be here as well. Thank you.
Thank you, Ann and Aaron. This is actually the third annual screening and panel discussion that we have had. We are supported by our national organization, American Families for Vaccines, which is the newly rebranded Safe Communities Coalition. It's the same good people, the same good work. We just have a new name. We are also joined today by North Saunders, who is the president of American Families for Vaccines. And North, I'm wondering if you can just tell us a little bit about why the name change.
Yeah, thanks, Kelly, and thanks to all of our panelists for being here and all the attendees. American Families for Vaccines is a national nonpartisan nonprofit that's made up of parents, clinicians, and community leaders, just like all of you who believe that every family deserves the protection that vaccines provided. We began as Safe Communities Coalition, and today we've evolved into American Families for Vaccines with chapters in states all across the country. Our mission is to support families, strengthen science-based vaccine policies, and make sure that the legacy of leaders like Dr. Hilleman continue to keep children safe for generations to come. To learn more about our work, you can visit our website, and I'll put that in the chat. Thanks so much for having us.
Thank you for getting that connection into the chat for us. Thank you for being here, North, and supporting this work. Um, Now, for our panelists, today we have four panelists joining us. We're going to allow them to speak for about 4 or 5 minutes, and then we are going to open it up for questions. You all should have access to a Q&A box, and we have Erin here today monitoring that, tracking some of the questions, and we've already actually received a few questions in that feed. Um, and then we're going to try to get to all of those questions before the top of the hour. So that is our plan. Really importantly, we have only 1 hour. So we're going to get to it. I'm going to ask Anne if you would please introduce our panelists today.
I'd love to. So welcome, everyone. We have some really important people to hear from today. Joining us are Dr. Nirav Shah, who's an MD and a JD whose expertise spans public health, digital health, and generative AI, public and private health insurance, and clinical operations across the continuum of care. We also have Dr. Sophia Newcomer, who's a professor at the University of Montana at the School of Public and Community Health Sciences. She's a research investigator for the Center for Population Health and the director of the PhD in Public Health program. Ms. Kirsten Hilleman is the daughter of Dr. Maurice Hilleman, and she's a professional working here in Montana, so another friend of ours here in this great state. And Dr. Paul Offit, who is the director of the Vaccine Education Center at Children's Hospital of Philadelphia. Very significantly for us, he's the Hilleman Professor of Vaccinology at the Perelman School of Medicine at the University of Pennsylvania. He is also the author of a biography of Hilleman, which is called Vaccinated: From Cowpox to mRNA, The Remarkable Story of Vaccines. And he was featured in the film. Back to you, Kelly.
Thank you. If you would like to know more about our panelists, we have posted their full biography or bios on our webpage, so please visit Montana Families for Vaccines. So, I would like, if it's possible, may I start with Dr. Shah? Um, I would like you to maybe set the scene for us and talk a little bit about this current political and social climate and why so many people are really challenging the validity of the work of people like Dr. Hilleman.
Great. Well, thank you so much. And it's such an honor to be here with everybody, especially to celebrate and discuss the life of, as you noted, Kelly, one of the most impactful scientists of the past 100 years. I don't feel quite worthy to be discussing his legacy, but I'll endeavor to answer your question, at least sketch out some ideas. I think there are two dynamics at play right now with respect to vaccines from the anti-vaccine skepticism movement. One are supply side factors and other on the demand side. On the demand side, what I mean is a steady drumbeat of skepticism that's designed to erode and diminish faith and ultimately demand in vaccines. And I think we've all seen that play out in various and different ways. Some of those campaigns are organically grown here in the United States. Some are funded and originated by folks in other parts of the world. But the ultimate goal is to sow doubt in the usefulness and the safety and efficacy of vaccines. On the supply side, the effort is designed, in my view, to make vaccines just that much harder to access in the hope that ultimately they become disfavored. Some of that has to do with altering the liability protections that vaccine manufacturers have, which may make them withdraw the vaccines. Some of it will entail changing some of the insurance rules to, again, make it that much harder for families, particularly families with young kids, to access vaccines. Why all of that is being driven? I know we only have an hour, but I'm going to just point out a couple of things that have changed, particularly since the pandemic. The pandemic left a lot of people unsettled, drove a lot of people to want clear answers to difficult problems, and was also suffused with this idea that public health can sort of be a libertarian adventure. You can choose your own pathway. And when you combine a lot of those factors, sowing doubt in vaccines and vaccine skepticism is only a few Instagram or Twitter clicks away. And that's undoubtedly one reason we're seeing a significant rise in that sentiment.
So you're identifying like social media as one of our enemies, challenges?
One of the, I mean, this sentiment existed prior to the pandemic, to be sure, but a lot of the unsettling of during the pandemic led to the rise of a lot of the folks that we're seeing as sowing a lot of this doubt right now, including and up to our Secretary of Health and Human Services, who's been at the center of a lot of this. He's been aided and abetted by the misinformation that's spread on social media platforms.
And doing some spreading. Thank you. Dr. Newcomer, you probably have seen all of this in action right here in Montana. And I have had a chance to see you do good work in this corner of the world. Can you talk a little bit about Dr. Hilleman's legacy and what people in rural states like Montana can be doing to address some of this?
Yeah, and thank you for having me, and thank you for hosting this important event. It's one of my favorite things that we get to do during the year as a coalition. So I'm a vaccine epidemiologist, and I am just so proud to work in this state that produced the greatest scientist of the 20th century, Dr. Hilleman. And we know that Dr. Hilleman was very humble, and he focused more on actually accomplishing the work than getting credit for the work. But I'm just really grateful to Montana Families for Vaccines for helping to keep his legacy alive in our state. I've just been thinking recently just about how thanks to Dr. Hilleman, we live in a state in Montana, our kids can thrive and live long, healthy, productive lives. And it's because of all the work that he did. Just in terms of like how we're working together here in Montana to keep immunization services alive and thriving. I would say for all the challenges that we have in a rural state, right? We have a lack of primary care providers. Montana is gigantic, and it's really hard to get to some places for folks. But for this, all the challenges we have a really strong public health infrastructure in Montana. We have a strong state immunization program that works really closely with our county health departments. And I would hope that if Dr. Hilleman were alive and able to be here today, he'd be thrilled to go out to Miles City in eastern Montana and see even in those huge counties with lots of agriculture that even those county health departments are stocking his vaccines and are promoting his vaccines. I'd say we also have a really strong chapter of the American Academy of Pediatrics. We have pediatricians, also family medicine docs from around the state who are constantly making immunizations a priority. So I think working together has been great. And so I want to add here is that Montana Families for Vaccines, which just started about 5 years ago, has really filled an important gap that was missing here. And that gap was mobilizing everyday people. So mobilizing parents, grandparents, teachers, scientists to come together and advocate for pro-child, pro-health, pro-vaccine policies in the state. So I think the work that we're doing together is amazing.
Thank you for saying such nice things about us. We have been loving the work we get to do. I love that you identified that we have this public health system that is so strong, and I don't know that every place has such a thing. What did we do right to help make that come to fruition?
So I guess I'm gonna edit it a little and say it's strong for the resources that we have,
Okay.
right? And so in the US, public health has historically been under-resourced. And I feel like now public health infrastructure, of course, is under attack and resources are being pulled. But for the resources that we do have, I think that we are doing good things. And I think part of it, and I would love to hear what other Montanans think, is that because Montana is a big, small state, we are huge, but we don't have that many people and we work together well. I think we also do have this legacy of helping and protecting each other. So I do think like helping our neighbors is a value that we have here in Montana. So I think getting all these stakeholders to rally around protecting health with the strength that we already have in public health and in our medical organizations, and then having Montana Families come and help mobilize that, I think we just already have that value infrastructure to build from.
I think you're onto something. We really do have that love your neighbor as yourself thing going on here. So thank you for identifying that. Kirsten, you are a Montanan. Can we talk a little bit about your dad? Kirsten is the youngest daughter of Dr. Hilleman. She's also one of the first recipients of the mumps vaccine because her dad did that to her. Kirsten, can you tell us a little bit about what it was like growing up in the Hilleman household, being the daughter of a dad like your dad, and maybe a little bit about what it's like to see so many people challenging the work of your dad?
Sure. I get that question a lot. What was it like to grow up with a dad like Maurice? And it was great. I will say my dad was a complete workaholic. He worked all the time, but he also made time for us when we were kids. He came home almost every evening for dinner. He did travel a lot. And when he had some free time on the weekends, we would do all kinds of fun, crazy things. We went to the graveyard and collected bugs, and I mounted them and pinned them and classified them, and labeled them. I had over 250 bugs in my collection. We built models, like we would go up to this place called the Monkey Mart and buy anatomical models and car kits and transistor radios. I grew bacteria in the basement with him. We did all kinds of really fun things, all designed to educate and spark curiosity. So it was really a wonderful experience growing up with my dad. And as to the second part of your question, I would say it's really heartbreaking to see what is going on today, because it's not only people challenging and questioning the efficacy and safety of vaccines, it's the weaponization of vaccines politically, which is devastating. And I don't know how we undo this. I tell people, be careful who you vote for.
Thank you for helping illuminate growing up. All of that petri dish work and the bacteria did not make you feel like you needed to follow in your father's footsteps.
No, it skipped a generation. We finally now have a doctor in the family. My nieces graduated from medical school.
You tell her thank you from us. Thank you. Our final panelist today is Dr. Offit. Dr. Offit, you probably know more about Dr. Hilleman than most people except Kirsten. Can you share some insights into the mind of a man who works so hard to save lives? And what are you seeing as some national trends we should be paying attention to?
He was unique. I really think that's true. He was relentlessly driven. It was never enough. Think about it. He either did the primary research or development on 14 or 9 of the 14 vaccines that we give to infants and young children. That's an amazing accomplishment. I was fortunate enough to work with the team at Children's Hospital of Philadelphia that created the rotavirus vaccine. That was a 26-year effort. I mean, trying to imagine someone who can do the primary research or development on 9 of the 14 vaccines we give to children was like trying to imagine a fourth dimension. And I think the thing that's most amazing is how right he was. I mean, it's when you make a medical product, including vaccines, there's a lot of missteps and a lot of false starts. Here was a guy who pretty much got it right all the time. Remarkable. And I think the other thing that struck me about him was he was really never satisfied. He told a story about sort of building fences when he was working in the farm, and they would work and work and work, and then they would sit down, take a break, have a bucket of water, say, and have a ladle, and they would pass around the ladle, and everybody would drink their water, and then they would go back to work. And that's sort of the way he described making vaccines. It was just the next one, and then the next one, and then the next one. So I never satisfied, and also remarkably humble. I mean, when you think about it, he's the measles vaccine is the Morton strain, the more attenuated Ender strain. It's not. There's nowhere that you find his name. The mumps vaccine is the Gerald Lynn strain. His name isn't there. So it was a remarkable combination of all those things. In terms of the political landscape, it's tough times. I think that Dr. Shah said it best. I think that in the first 2 years of the pandemic, I think we kind of leaned into this libertarian left hook. In the first year, when we didn't have anything, 2020, when the virus was coming into this country and starting to kill people, we didn't have antivirals till October. We didn't have monoclonals till November. We didn't have vaccines till December. So what did we have to try and stop a virus that could be spread asymptomatically and was killing people? So we restricted travel and we shuttered schools and we closed businesses and we masked and quarantined and isolated and tested. And I think that there was a percentage of this country that saw that as massive government overreach. And then the second year when we had a vaccine and you couldn't go anywhere without your vaccine card, so you couldn't go to your favorite bar or restaurant or sporting event or place of worship, or you may be fired from work. That too, there was a backlash. And I think that's what we're seeing. The backlash is against all of that. And I think the mRNA COVID vaccines have gotten caught up in that backlash. And now it's cool to think that that the COVID vaccines were more dangerous than helpful, which is what our Secretary of Health and Human Services is currently saying while he stands up in front of the American public and doesn't recommend this vaccine for healthy young children or for pregnant people, which is remarkable when you consider that we're the only country in the world that does not consider pregnancy to be a high-risk condition for severe COVID. And most of the hospitalizations, or many of the hospitalizations in children, are children less than 6 months of age. So obviously, vaccinating during pregnancy is critical. So it's hard to watch this. I'm not sure what it's going to take to turn things around, but I fear things are going to get worse before they get better. They may have to get worse before they get better.
I really did not want to hear you say that. Because of COVID, if we saw a backlash, what comes after a backlash? So I'm hoping there's something hopeful that might be on our horizon. Can we
Hopeful.
expect?
You're looking for hope. Okay, so
Yeah.
here's what I would say. I think science is a powerful thing to have on your side. And I think what you're seeing now is you're seeing people declaring their own truths, including scientific truths. I think that science is losing its place in some ways as a source of truth, but it is a powerful thing to have on your side. And I guess the image that I have that makes me feel better, even though I have to go back to the 1600s to find it, is Galileo. So Galileo, right, famous astronomer, he, described, the moons of Jupiter and the rings around Saturn, the phases of Venus, and he wrote a treatise. But it was his second treatise that got him into trouble because in that treatise he bought into Nicholas Copernicus's notion that the Earth revolved around the sun, and that was against the teachings at the time of the Roman Catholic Church that the Earth was the center of the firmament. So he was brought before this Roman Catholic tribunal. He was put in chains. He was forced to sort of try and recant that. But as he was walking out, he said regarding the Earth, and yet he said, still moves. Meaning you can tell me you can say that have me say that it doesn't move, but it still moves. And I feel that way now. I think Robert F. Kennedy Jr. in the next few months is going to hold up some bogus paper, call it gold standard science or a landmark paper, and claim that let's say aluminum adjuvants in vaccines cause autism. Because everybody who's been paying close attention to this thinks that's where it's about to go. And then it doesn't matter, but I would say this: it doesn't matter how many sycophants or fringe doctors or fringe scientists or media venues or congressmen he gets to echo that theme. The fact of the matter is he's wrong, and ultimately science does win out in the end. And we may have to pay a price for that, but knowing that you have science on your side is a powerful thing to have on your side.
The truth will out. We just hope it doesn't take centuries. Thank you. I know that, well, let me pause and see if any panelists have questions for other panelists.
Well, just to build on what Dr. Offit noted, because Kelly, you asked for hope, and there are two elements, one historical, one epidemiological, that give me a glimmer of hope right now. One is these trends of vaccine skepticism have existed throughout history, going all the way back to Jenner. Now, I have no way of knowing whether it was as pronounced then as it is now. Perhaps it's more exacerbated now, but this idea that there's a pushback is not a new one. And then the other is, notwithstanding the rise in anti-vaccine sentiment, the vast majority of parents in the United States continue to vaccinate their children. It's down, and the trend is concerning, of course, but it's still the overwhelming majority. That could change, and that's why we're all expressing the alarms that we are now. That said, we're not yet in jeopardy.
Okay. And the vast number of parents do vaccinate their kids. So thank you for reminding us of that. Erin, you have been tracking our Q&A feed. Are there questions you can lump together and
Yes. Our first one is for Dr. Newcomer. How do immunization rates in Dr. Hilleman's birthplace of Montana compare with national averages and public health goals? Thank you.
Yeah, sure. So what we see in Montana is what we see in most rural areas of the US. So when we look at data about rural vaccination in the US, we see that there's persistently lower vaccination rates. So I was looking at like recent CDC data. We have in the rural US, MMR vaccination among infants is about 4 percentage points lower. It's the same in Montana, or about 4 points lower than the national average. I know with 4 points might not sound like a lot, but with a disease that's infectious as measles, actually those small increases in vaccination rates could really go a long way. But with other vaccines, for example, rural areas of the US are 11 points behind in human papillomavirus vaccination than urban areas of the country. And then for childhood influenza, it's a whopping 20 points lower in terms of childhood influenza vaccination in rural areas than in urban areas. And so I alluded to this earlier, but there's a lot of challenges with vaccination in rural areas of the country. We've talked some about attitudes, and of course, as we know today, vaccine attitudes are sometimes aligning with political affiliations, and we know that we have different political affiliations in more rural areas of the country. But what we also know about childhood under vaccination in the US is that most under vaccination is not the result of attitudes. For most vaccines, most childhood under vaccination is driven by challenges with access to vaccines and quality of healthcare services. And so the fact of the matter is, in rural areas of the country, immunization services delivery looks different than it does in urban areas of the country. And I think one thing that we could maybe focus on, we could find all agreement to focus on, is just how we can strengthen delivery of preventative care in rural areas. And I'll just give you one example. I used to live in Colorado, and when my kids were little, I lived in Denver. I was part of a large integrated health system. So in urban areas, people are more likely to be part of like large clinics, large health systems that have like great technology. And we know that one way to improve vaccination rates is to let people know that they're due for vaccines, or to let parents know that their kids are due for vaccines. Even as a vaccine epidemiologist, I need help. I need help tracking my kids' vaccination records. So when I was part of a large health system, I would get a text reminding me. If I missed an appointment, I would get a text reminding me to come back. If my kid got overdue, I would get a text or an email or a letter. This is called reminder recall. Well, when we look in rural areas of the country, and we're often talking about like a private clinic that has 1 or 2 doctors and a couple nurses, and then we're asking them to implement a very high-tech system, that's just not reasonable, right? So we need to find ways to invest in the type of infrastructure that we know works in higher resource settings, and find ways to make those type of strategies work here. Also have the investment, and just note that we can do this and not really have to talk about attitudes, right? It's talking about improving preventative care. So I'm hoping that like as we navigate toward these uncertain times and dealing with a lot of different talk about vaccine hesitancy and confidence, perhaps we can pivot a little bit and just talk about improving preventative care in rural areas.
Wow, thank you. Panelists want to respond to Dr. Newcomer? You really give me hope that there are really positive things we can be working on, even if the internet is saying something different and some of our leaders are saying something different.
Montana Families for Vaccines, you guys know I'm an optimist. I'm just always the optimist.
I
love it. Thank you.
Thank you, Sophia. And I have an add-on question that segues nicely to what you just said. We had someone ask, could you please talk about the increase in childhood vaccination exemption requests that we've been seeing across the states? And how might this be exacerbated by the federal administration's attitude toward vaccines?
Yeah, actually, I don't know. I kind of think North should take that one. North, do you want to address it, or do you want me to start? The policy question.
Sorry, I was trying to get off mute. I mean, I think having someone leading the nation's public health that sows disinformation and distrust in vaccines is going to lead to declining immunization rates. And that's the outcome of the anti-vaccine movement gathering power, gathering strength, and exercising what they think is their voice. And so, like, I think that declining or increased exemptions like needs to be fought at every level. That's working to make sure there's access, to make sure that there's good information, and to make sure that there's strong policy at the state level so that people aren't exploiting exemption loopholes.
Yeah, and I'll just add to that, which is just to make sure that, people who are listening in know that the policies around requirements for school and childcare vaccinations, and then how easy it is to get an exemption from those requirements, is all regulated at the state level. So that's why groups like American Families for Vaccines, which is working to help different states set up these coalitions like Montana Families for Vaccines, we work together to advocate for strong policies. So that we can keep vaccination rates high for kids that are going to childcare and schools. And I think Montana has been a great example. I mean, we have a majority conservative legislature. And every session that we've been involved with as a coalition, there have been attempts to make exemptions easier. And I think that working together and getting parents and grandparents to show up at the Capitol has been really effective in especially beating back some of the policies that could have basically made it really easy to get out of vaccine requirements. So I think advocating at the state level is super important right now.
Thank you for the good reminder.
We have a question for Dr. Offit. How do you explain RFK's hostility to vaccines to the public or to legislators? It's very difficult to make a scientific argument to non-scientists and very hard to explain why this is happening without a narrative to explain RFK.
Right. So RFK Jr., if you read his book, The Real Anthony Fauci, and I don't recommend it, but if you look at pages 285 to 289, he tells you that he does not believe in the germ theory. He doesn't believe that specific germs cause specific diseases. That's number one. He believes in the terrain theory, that if you're well nourished and you exercise and you eat the right foods, that you're not going to get an infection that's going to cause you to be hospitalized or die. So that's it. So when those two children, for example, in West Texas, those healthy little 6 and 8-year-old girls died, the first thing he said was they're malnourished. They're in a food desert, neither of which was true. And that people should take vitamin A, which frankly means does not work in this country. We don't have much vitamin A deficiency in this country. Works in Kenya, doesn't work here. So that's his basic. I know it's hard to believe that the head of Health and Human Services does not believe in the germ theory, but he doesn't. More importantly, he believes that vaccines have simply traded in infectious diseases for chronic diseases, and that if he can eliminate vaccines, make them more difficult to get, more expensive, more feared, that therefore he will lessen the incidence, if not eliminate the incidence of chronic disease. As he said, his quote, "I was put on this earth by God to lessen the incidence of chronic disease in children." And when he says chronic disease in children, he means one thing: autism. As he said, autism is preventable, and I'm going to find what I can do to prevent it, which means lessening vaccine use. That's what he believes. He's believed it for 20 years. He's a zealot. He means it. And I think people have trouble understanding somebody could be that far gone, frankly. I mean, he's completely science resistant. You can show him study after study after study. There are 24 studies out there showing that the measles, mumps, rubella vaccine does not cause autism. He still says measles, mumps, rubella vaccine cause autism, as he did on Jesse Water's show not long ago. So that's what you're dealing with. You're dealing with a person who is been an anti-vaccine propagandist and science denialist for a long time. And when he stood up and give that little 1-minute video with Marty McCary on his right and Jay Bhattacharya on his left from the FDA and NIH, and said that he is no longer recommending the COVID vaccines for healthy young children, knowing that over this past year, according to the CDC's own data, thousands of children were hospitalized with COVID, that about half were previously healthy, that 1 in 5 were admitted to the intensive care unit, and that 152 children died. Those are the data on which the decision had been to vaccinate healthy young children who've never been vaccinated before. And so what is he basing that on? Nothing. What he's basing it on is he thinks vaccines are evil. And when the American Academy of Pediatrics, to their credit, stood up and said, we need to vaccinate children, here's a clear black letter recommendation to vaccinate young children who haven't been vaccinated before. What did he say? Remembering that he's a conspiracy theorist, he said they're all in the pocket of the industry. It's just they're in the pocket of the pharmaceutical industry because he doesn't have the data. He doesn't have the data to support his non-recommendation. And that's what you're up against. And, I try to do this. I mean, I have, in theory, a meeting next week again with Senator Cassidy, but I am losing hope that you can get, I mean, what changes this? I mean, either Congress steps up, that the Republicans in Congress step up, walk into President Trump's office and say, look, we can still have the MAHA movement we want without having this anti-vaccine activist in that position. Or we can get the companies to stand up and say, make it onerous enough for us to make these vaccines. And that'll happen if you disrupt the vaccine injury compensation program and we're out. They're not going to do that. I've talked to people. They're not going to do that. So the third way, and this is where something we can do something about, I think, is that when these infectious diseases happen, like measles, we have 266 deaths from influenza this year. We haven't had that number since 2009. We have a handful of children a handful of states who have experienced pertussis deaths in children, whooping cough deaths in children, that haven't seen deaths in children in years. Make those come alive in some way. Make people feel that, because I think the statistics are less meaningful than the actual feeling it. And I think that's our challenge. Just one last thing is there's a woman named Alyssa Kanowitz, who's head of the Amanda Kanowitz Foundation. And I had to give a talk and she was speaking before me. But so she tells the story of her little girl, her little 4-year-old daughter. And you see little videos of her daughter interacting with parents and friends and family. Bright, active, attractive little girl. And then she tells a story of watching her child die of influenza. And it's just, falling off a cliff in slow motion. And nobody that was sitting in that room wasn't crying. And that is, I think, what we need to make people feel. Because, not to quote Stalin, because, you're probably not supposed to quote Stalin in like talks, but, what Stalin said was, one death is a tragedy and a million deaths is a statistic. And we have to make people feel this.
Feel the tragedy. Dr. Shah, it looks like you may be able to add to that.
Well, perhaps without invoking a horrible autocratic dictator, I will just I will pick up on what Dr. Offit noted in terms of an advocacy strategy that is of that same spirit, and something that North and I have talked about up here in Maine as well, which is scientific data are helpful, but I have rarely found that they are convincing to individuals who are on the fence or outright averse to the view you're pushing. I think what is and can be convincing is a story, which is really what Dr. Offit is urging. And I think stories are far more powerful. Stories buttressed by data can really alter someone's perception of what the problem is, how widespread it is, and put a human face on it. Data alone are usually, except in the most rarefied of rooms, data alone are usually insufficient to really do a lot of convincing. But the stories that we can marshal in service of this, those can really, truly have an impact.
And that's why you're so important, Kirsten, because you're part of the story, the good part of the story. Erin, I thought I saw a question for Kirsten. Did you get one?
Yes, I do have one for Kirsten. Many people in healthcare and public health are feeling tired these days. So your dad also faced challenges, different types of challenges, but he faced them. And what motivated him? And what role was his personality in getting all of the work done that he was able to accomplish?
I think Dr. Offit touched on it. He was just incredibly driven. And when you watch the movie, you see how the influence of growing up on a farm in Miles City, Montana in the 20s and 30s influenced his drive. I think a lot of it was, the work he had to do on the farm, taking care of animals, bitterly cold weather, running to school. It was not an easy life. It was hard. And he used to tell stories about how his Aunt Edith showed him tumors in the chickens and would explain to him, we can't eat those chickens are sick. His biological father, was a nurseryman, and they would point out different diseases on the trees. So there was a lot of that awareness of mortality, a lot of awareness of disease, and there was, a sort of a connection. I think we've become removed from those connections in our daily lives and minor life. And he just set a goal to prevent as many childhood diseases as he possibly could. And he kept at it. He didn't stop. When he finished one, he moved right on to the next one.
Wow. We were lucky to have him.
All of us.
Our next question is for Dr. Shah. It's kind of a two-part. Are there any evidence-based ways to counter misinformation on social media, and what can regular people do to address the misinformation they may be receiving?
There are a few strategies. Evidence-based may be a stretch, but at least they've been tested and validated by psychologists and cognitive scientists who look at this. They're difficult though, and there's an old adage, which is that the time it takes to refute misinformation is 10 times, 100 times greater than the time it takes to produce and spew it. And so that's one reason this is very difficult. That said, there are a couple of things that we tried to do at the CDC, as well as when I've been at the state level, to try to get an end run around misinformation. One is the term it goes by is pre-bunking. And you hear Dr. Offit sort of signal this in some of the remarks he's made just today, and essentially calling out what the misinformation coming your way is going to be. You've already heard Dr. Offit essentially lay out the roadmap that the secretary is going to be taking over the next 3 to 5 months with respect to autism, what he's going to finger in the vaccines, aluminum, what that means. Now is the time to start calling that out and pre-bunking that misinformation. So it's just that much less likely to take hold. Another strategy that can be useful, we've already mentioned storytelling. But on social media, this is much harder. But in one-on-one conversations, what definitely does not work, is treating a skeptic as your opponent in a high school debate match. We've all been in situations with somebody who really believes something very fervently and just is like a dog with a bone and won't leave us alone until we change our mind. And usually that doesn't work. Usually people leave those discussions hardened in their beliefs. A softer approach is to make room for earnest skeptics to express their concern, and then having clinicians, scientists, healthcare providers answer those in a neutral way. The third is much bigger, and this kind of goes to Kirsten in a sense. One of the ways in which public opinion has been galvanized over the past 50 years is through movies and TV. And I have to say, your father's story would make an amazing movie. When I was in college, the reason everyone wanted to go to med school was ER. I mean, that's what drove us all. And a movie based on the challenges and the successes your father had could really galvanize the way that people think about science and scientists, to say nothing of vaccines. So if you know anyone in Hollywood, I certainly don't, but if anyone here does, this is a movie waiting to happen.
We have a mission. Dr. Offit had a chance to pre-bunk this autism, misinformation. You just mentioned aluminum. Would you like to do a little pre-bunking while we have you here with us?
Me, sure.
Oh, either. Yes.
Did you want Dr. Shah? Yeah, okay. So
Dr. Offit is the world's expert in this. Okay. I'm just a guy, so definitely better to have him.
Just the guy, right? So aluminum is the third most abundant element on Earth. Assuming you live on this Earth, and I haven't met all of you, but I'm going to make that assumption. You are exposed to aluminum all the time. It's in soil, it's in plants, it's in water, anything made from water. infant formula, breast milk, you get far more aluminum exposed to infant formula or breast milk than you would ever get from a vaccine. So that's number one. Number two is, but that doesn't prove it. That doesn't prove the concern that aluminum adjuvants in vaccines are problematic. So aluminum adjuvants have been in vaccines really since the late 1920s, since 1926, and are there to enhance the immune response, which enables you to give fewer doses, enables you to give lesser quantities of the vaccine component itself, and is really necessary for some, say single protein vaccines like the hepatitis B vaccine or the human papillomavirus vaccine, et cetera. It's not in live attenuated viral vaccines, but it's in about 7 vaccines given to infants and young children. So how do you know it's not harmful? There was an amazing study that was just published in the Annals of Internal Medicine by a researcher out of Denmark whose last name is Vid, Hviid, Anders Vid. And what he did was he looked between 1997 and 2020, so basically a 23-year period, during which time children in Denmark receive various amounts of aluminum adjuvants ranging from 0 milligrams to 4.5 milligrams. Remembering you're exposed to about 7 milligrams of aluminum, assuming you drink breast milk in the first 6 months of life, more like 38 milligrams if you're formula fed and 117 if you're soy formula fed. So you're exposed to far more aluminum otherwise, which is why when children get aluminum containing vaccines and then you look in their bloodstream or hair, you can't tell that there's any difference or any relations to a previous vaccine history. But anyway, what Vid did, now he's looking on a milligram per milligram basis over a 23-year period. Is there anything that pops up as a problem? And he looked at autoimmune diseases, allergic disorders, neurodevelopmental disorders, basically 50 different disorders, and found that there was no association with anything. It was a beautiful study. I mean, no study is perfect, but this was darn close. And you could tell that it got on Robert F. Kennedy Jr.'s nerves because he immediately responded to it and said, no, they're in the pocket of industry. This RFK Jr. is a one-trick pony when it comes to anybody saying anything positive about vaccines. They're all in the pocket of industry. So that was the first thing he said. And then he had another of other comments that he made that just were refuted by 2 people. One by Anders Vid himself, who actually weighed in and said, look, here's why he's wrong. And then the other person that refuted it was a group named Unbiased Science, headed by Jessica Steyer, did a great debunking on what RFK Jr.'s rebuttal was, because that's what he's about to say. So I think Dr. Shah is right. I think we do need to anticipate these things, knowing that RFK Jr. will never accept science that runs counter to his false, immutable, science-resistant beliefs. He never will do that. So that's not going to convince him. You're just trying to convince everybody else. And I think one of the better ways is to let people know that they're always exposed to this. I was on the advisory committee for immunization practice between 1998 and 2003. So I lived through the thimerosal nightmare. But, aluminum, people think of like aluminum foil. The same thing with mercury. I mean, mercury never sounds good. But again, assuming you live on this planet, you are exposed to far more methyl mercury, assuming you drink anything made from water, than you ever get from the thimerosal and vaccines. So I think people need to see that. I remember I had to testify in front of Congress once. I think it was Frank Pallone from New Jersey stood up and said, when it comes to mercury, I have zero tolerance. If you have zero tolerance for mercury, you got to move to another planet. And if you ever testify in front of Congress, congressman moving to another planet is not the worst idea. That's just.
Well, I don't intend to move to another planet. Thank you so much. We'll need to practice our debunking skills because that was pretty much gold star of debunking right there. Erin, do you have any other questions?
We have a couple more questions, and one is for Dr. Newcomer. What can states do about the increase in exemption rates, particularly religious exemption rates?
Yeah, that's a great question. And so I can just elaborate more on what I said earlier, which is that all of these policies are regulated at the state level. And so right now, all states do require vaccines as a condition of participating in childcare or school. This is super important, right? We have people in our population who really need to benefit from others around them being vaccinated. So we have kids in childcare who are too young to be fully vaccinated, right? So they need their peers, the kids around them in school, to protect them from infectious diseases that are circulating, right? We have teachers that work in schools that maybe have been vaccinated in the past, but if they've gone through cancer treatment, and we have kids also who are immunocompromised, right? So as a condition of being in these congregate settings, we have an obligation as a society to protect these vulnerable individuals. So we have these policies. But like I said earlier, there's a ton of variability across states in how easy it is to not get vaccinated and to go to childcare school. So the first thing I'd say is that if this is something that concerns you, and I would say that it should, especially if you're a parent, a grandparent, if you care about keeping infectious diseases out of your communities, get to know what your state policies are. How easy is it to get an exemption? Right? And how might you find this out? You might be able to go online. If you have a state families for vaccines chapter, that's a great place to start. Many states have an immunization coalition. That would also be a great place to start. And then get involved because I'll tell you, I'm a scientist, I'm an epidemiologist, and it wasn't until 4 years ago that I got connected with Montana Families for Vaccines and our AAP chapter, our American Academy of Pediatrics chapter in Montana, that I became involved in policy and talking to legislators. And I talk as a mom and I talk as a scientist, and I tell you, it's very impactful. And having parents show up and talk about wanting to protect their kids from infectious diseases can be really impactful. So get to know what your state's policies are and get to know how you can get involved and make your voice heard.
Thank you. It's kind of a plug for joining us on American Families for Vaccines. If we could get some people to join us in this, that would be wonderful. We are coming very close to the end of our hour. What I would like to do is open this up to all of our panelists for a final question for you all. And that is, what would Dr. Hilleman be expecting of us now? If we could all channel our inner Dr. Hilleman, what would be his best advice for dealing with this political landscape that we're in, this vaccine hesitancy and misinformation that we're seeing? I don't know who would like to go first. I want to ask Kirsten just because you knew him, but we'll let Dr. Offit.
Have this like Brady Bunch feel here,
It is.
Yeah, sorry. It's this when so we eliminated measles from this country by the year 2000. Dr. Hilleman is the inventor of the current measles vaccine, which came into play in 1998. When Andrew Wakefield published his paper claiming falsely that the measles, mumps, rubella vaccine caused autism, that started to erode vaccine rates in this country. So much so that by 2004, you were starting to see the virus come back to some extent. And I remember sitting in his office, and it was a wintry day in suburban Philadelphia, and he's there's a sort of snow in the background in his office. And I said to him, as measles was starting to come back, this was a defeat for him. I mean, he had worked so hard to get us to basically eliminate from this country the most contagious human infection, a remarkable accomplishment, right? And now you were starting to see cases because parents, a critical percentage of parents were choosing not to vaccinate their children. And so I asked him this question: what changes this? What gets on top of this? Because there's two possibilities. One, we do our darndest to educate people about the importance of this vaccine and the seriousness of this disease, and that's what changes it, that we can educate away from this. Or two, that the virus does the educating. In other words, that enough people get sick or suffer or be hospitalized or worse, die, that's what educates. And he looked at, I'll never forget the scene. It was one of the more dramatic, at least for me, in interacting with Dr. Hilleman. So he sort of turned away from me. He was looking out the back window and thinking about his answer. And then he turned back to me and almost with tears in his eyes, he said, no, I think the virus is going to have to come back for people to understand how serious this is. So I hope he's wrong, but he might be right. And he was right a lot.
Yeah, that's overwhelmingly sad that there are little kiddos out there who will pay the price for our ignorance or hesitancy. Kirsten, if you channel your best thinking of your dad, what would he encourage us to do right now?
I think there'd be some interesting language involved. My dad, my mother liked to call those Montana adjectives. And I think to a certain extent, Paul is right. And it's beginning. I mean, in Montana, correct me if I'm wrong, there were 19 cases of measles in Gallatin County alone.
And we just had our first case last week, I think, here in our county.
Yeah. Pertussis made a big comeback in Gallatin County as well. Big kind of hot spot around that school that uses a lot of exemptions, funded by you know who. I won't go any further than that. So I think that he'd be very frustrated. I think he would be angry. I think it's heartbreaking. And again, you got to do what you can to educate yourself and be careful who you vote for. I'll say that again, over and over and over again. It's
Sure.
critical to look at all of our Montana senators and representatives voted to confirm RFK Jr.
I feel close to a Montana adjective right now. Dr. Shah?
I didn't have the pleasure or privilege of knowing Dr. Hilleman as obviously his daughter, Dr. Offit did. But what is remarkable in the documentary is his courage and his tenacity. There are moments in the documentary when I would have, I think, had I been in his shoes, would have shied away from making the tough decision. The decision to move forward in the 55 influenza pandemic, the decision to pull the polio vaccine because of concerns around SV40. The courage in those moments is remarkable. And I was very moved when I was watching it because of his focus. And as Dr. Offit said, he was right. The other aspect that I suspect he would urge us to in this game is tenacity. I mean, and a lesser man would have just called it quits after developing one vaccine and said, I changed the world. I'm gonna hang up my hat. But he went on to develop a dozen more. And that kind of tenacity in the face of overwhelming problems is what's called for right now.
Yeah, thank you. Dr. Newcomer, can you bring it on home? Oh, you're on mute. Thank you. Oh, there you go.
Well, first, I just want to say thanks again for hosting this event. I really enjoy just revisiting this documentary every year, and especially during Immunization Awareness Month. Also, right ahead of what would have been his birthday. Just what a treasure to have in Montana's history. And so I think, and this is very much in line with what Dr. Shah was just saying, but one thing I always take away is just whenever I watch the documentary is just to keep working hard. And we can all keep working hard to keep his legacy alive here in Montana and across the country. Work hard with the goal in mind of protecting people's health, protecting children's health. We all can play a role, right? Whether we're a scientist. I'm looking out the window and classes are about to start next week. So I'm thinking about, how do we continue teaching about vaccines? How do we continue teaching about infectious diseases? But everyone here on the phone can also, or here on Zoom, can get involved, right, with policy, speaking to legislators, speaking to your friends and community members about what we want to be doing together to protect ourselves and our loved ones from infectious diseases. So keep working hard, just like Dr. Hilleman did.
Thank you. Tenacity and hard work. We're good at those things, so we can do that. We have come to the end of our hour. Thank you all for joining us. I would like to thank our panel for sharing your expertise, and I encourage you to watch the video if you haven't already. Share it with others and get others to watch it as well. We also encourage you to visit the American Families for Vaccines website and sign up to get more information. I think our panelists have said it a number of times today. Our power is in truth and science and the sheer number of like-minded people joining forces together. I don't know of a better way to do that than for us to get all on the same website, American Families for Vaccines, and start working together. We'd also like to thank our partners and state chapters for supporting our work today and helping us to make this possible. And I really want to especially thank our panelists for sharing their insights, their wisdom, and their humanity with us today. I know you can't hear this, but all around the country, we have people applauding you right now. We want you to encourage doing the good work. So thank you all. I hope I get to see you all soon in our travels through this work. Take care.